Dear students, welcome again to EPG Pathshala. Today we are going to talk about the principles of athletic care. Excellence in sports is the result of regular and intensive physical training which stresses the body to the maximum. The athlete requires a perfectly fit body to withstand the stress, and often athletes are disabled by the problem that has little impact on the ordinary persons. Often athletes are disabled by the problems which produce little effect on the functioning of a non-athletic individual. The ultimate goal of the athletic care is to prolong the quality length of a player in sports. Injury and recovery are the two main problems of the players. Sports injuries are the inherent risk of sports participation, and untimely injury prevents a player from competition, and it carries a significant price tag in terms of man, money and motivation. Injury may stop a player from training effectively, and if intense training is carried out ignoring their presence, these injuries becomes chronic and difficult to treat. Untimely and inadequate management of injury is one of the main reasons for reduced performance and premature retirements of the players. Similarly, the another area of concern is the recovery. The recovery from the stress of exercise is one of the prime concern of anyone involved in sports and physical training. Inadequate recovery not only reduces performance, but it also acts as a risk factor for injuries. Many athletes are not able to withstand the rigor of training because of inadequate recovery. In order to ensure adherence to training and excellence in competition, it is necessary that a support system is established within every training center for the management of sports injury and also for the recovery of the sports players. It is essential to establish a support system for treatment and prevention of injury and recovery within sporting environment. The successful management of sports injury is not possible without the active involvement of coach, organizer and the supporting staff. Therefore, it is necessary that everybody associated with sports should have a basic knowledge of the principle of care of athlete. In this module, we shall be talking about the spectrum of sports injury. We will describe the process of healing and repair of an injury. We will explain you the process of management of sports injuries, and last but not the least, we will be talking about the need of recovery for the sports person. Excellence in sports requires a perfect body to withstand the stress of regular and intensive training. And often the athletes are disabled by the problems which has little effect on the functioning of a non-athletic individual. For example, if me, a professor, he develops tendinitis of biceps muscle, it may not affect my functioning very much. But at the same time, if the same bicipital tendinitis happens to a thrower, he may not be able to participate in the competition. The care of athlete should focus on all those small problems which may retard the competition and the training rigor of the player. The ultimate goal of athletic care interventions is to prolong the quality length of the sporting career of an athlete. In general, we can come across two problems of an athlete. One is injury and the second one is recovery. Injuries are the inherent risk of sports participation. There would be hardly any player who had not sustained any injury in their athletic career. But these injuries, they often carry a significant price tag in terms of man, money, and motivation. Untimely injury may prevent a player from participating in the competition, and many a time a devastating injury has the potential to end the career of the player prematurely. The another aspect of the athletic care revolves around recovery. During training and competition, the enormous amount of stress is applied to the body. The recovery from that stress is extremely necessary, not only for the prevention of injury but also for the excellence in the next round of performance. Inadequate recovery, it reduces the performance and often act as a source of injuries. Untimely and inadequate management of athletic problems has the potential to prematurely end the career of a player. In my opinion, this is one of the major reasons for the reduced talent pool of the country. Therefore, everybody who deals with the sports, be it a player, be it a coach, be it organizer, they should also know the principles of management of the sporting. Although the prime responsibility of managing the sports injury lies with the doctors and physiotherapists, everybody dealing with the sporting activity must have a basic understanding of the process of athletic care so that a suitable help can be rendered to the player in a time-bound manner. In this module, we will first discuss about the process of injury and the principle of its management. In the later part of this module, we shall talk about the recovery and the methods of promoting faster recovery in a tired athlete. Sports injury is the result of excessive mechanical force. We can define sports injury as the disruption of the continuity of the structure, which may be gross or which may be microscopic. The sports injury mostly affect the locomotor system of the body, and often the ligament, tendon, muscle, capsule and other soft tissues are involved. On the basis of mechanism of injury, we can classify the sports injuries into two major groups: acute injuries and overuse injuries. Acute injuries result from blunt trauma or a sudden overload. They produce instantaneous disruption of the tissue. On the other hand, overuse injuries are the culmination of multiple microtrauma resulting from repetition of a particular movement pattern without adequate recovery. Acute injuries can be broadly divided into two groups: minor acute injuries and major acute injuries. The minor acute injuries such as sprain, strain, contusion, abrasion, lacerations are quite common. These injuries, they produced minor discomfort, but they disrupt the training schedule of a player. The incidence of major acute injuries such as fracture, dislocation and the major ligament rupture, neurological damage or injuries to the vital organs such as eyes, intestine, brain are fortunately quite few. But when these injuries take place, they significantly curtail a person's involvement in the sports. Many a time, a sports injury has forced the permanent retirement from the sports. Overuse injuries such as tennis elbow, swimmer's elbow, etc. are the culmination of microtrauma resulting from repetition of a particular movement pattern without adequate recovery. These injuries develop slowly and in the initial stages do not produce as much disability as the acute injuries. However, these injuries progress over the time and are the main cause of the inconsistent performance of the player. On the basis of severity, acute injuries can be divided into following three grades: first degree injury, second degree injury and third degree injury. First degree or mild injury produces microscopic damage to the tissue with no loss of continuity. That means the tissue is virtually intact, but there is damage to some fiber of the tissue. There is a minimal swelling and bruising, but pain is felt at the end of the range of movement or the stretch or on the contraction of muscle. There is no joint instability, muscle spasm is minimal, and characteristically there is no loss of function. The second degree injury is characterized by macroscopic damage to some fibers of tissue that produce structural weakness. There is a moderate swelling and bruising with moderate pain felt on any movement which interferes with the ability of muscle to contract or lengthen. In case of ligament injury, there may be now some joint instability. These injuries, they typically produce loss of function, means they put a hindrance to the performance of the athletic maneuvers. The third degree injury refers to a complete tear of the injured structure, and it is characterized by significant swelling, intense pain, profound muscle spasm, and severe loss of function. The presence of gross instability indicates the third degree ligament injury, whereas inability to exert force indicate the third degree muscle injury. Now we shall talk about the pathophysiology of an injury. Before we talk about the management of a sports injury, it is important to understand what happens in the body once it gets injured. When the body sustains an injury, it undergoes a systematic process at the site of injury that attempts to heal the area. And injury is basically a gap in the tissue. And during the process of repair, the body attempts to bridge the gap either by the same tissue or by some non-specific connective tissue. When we talk about the healing, we refer to a process in which the body attempts to restore the anatomic continuity of a structure by laying down new tissues to bridge the gap. The biological processes related to injury and healing are strikingly similar, irrespective of the type of tissue. That means the same pathological process will operate if there is a ligament injury, the same process will operate in case of muscle injury, and also the same process will operate in case of the skin injury. That makes the task of understanding the process of repair of an injury a bit easier. Every injury passes through the following three distinct but overlapping phases: the phase of acute inflammation, phase of repair, and the phase of remodeling. The first stage is acute inflammation that lasts for about 48 to 72 hours. Thereafter, the process of regeneration and repair takes place, which takes about, depending upon the type of injury, somewhere between 7 days to 21 days or 6 weeks. The third stage of remodeling, it continues for a pretty long period of time. Now we shall discuss each of these processes of healing and repair. Stage of inflammation is the first stage of injury. Acute inflammation is the response of living vascular tissue to injury, and it gives rise to the clinical symptoms of swelling, pain, redness, heat, and loss of function. The purpose of inflammation is to contain the initial damage, remove the debris and dead cells from the site of injury, and prepare the ground for the damaged area. If there would be no inflammation, there would be no repair. So inflammation is essential for repair, but it is always in excess. The injury is associated with the death of cell and the rupture of capillaries. The blood vessels of the injured areas dilate, and that increase the blood flow to the area, and this brings increasing number of white cells to the field of injury. The WBC, along with the dead and injured cells, release several chemical substances. These substances increases the permeability of blood vessels that allow the seepage of protein-rich fluid and blood cells to move into the tissue space and cause the swelling of the part. The swelling compresses the blood vessels and nerve ending of the area and give rise to pain and ischemia of the non-injured cells. Ischemia is the loss of blood supply. The non-injured cells are also damaged due to the action of white blood cells when they begin the process of removal of dead cell. The net result of inflammation is to increase in the extent of damage. Hypothetically, if 10 cells are damaged during the initial injury, then within the next 24 to 48 hours, the number of damaged cells would increase to 100, principally because of the acute inflammation process. The another problem with acute inflammation is the leakage of protein-rich fluid. That protein-rich fluid we call in medical terminology exudate. So this exudate has the tendency to coagulate, and if it is not removed in time, it consolidates and it binds the tissue to each other. This produces the painful adhesion in the later stage of healing and repair. The aim of the phase of repair is to bridge the gap within tissue by formation of new tissues. As the inflammatory responses recedes in intensity, the process of healing intensifies. Depending on the intensity and location of injury, this phase may last for 72 hours to 6 weeks. The dead cells are replaced by either new cells or by the new fiber-producing cells. These cells starts building a haphazard network of collagen fibers. The formation of new blood vessels in place of damaged one also begins, which carry blood to the repaired area and provide nourishment and stimulation to the cell engaged in the process of repair. This newly synthesized tissue comprises of collagen fiber, matrix, and newly formed blood vessels that bridge the gap of the injury. This newly synthesized tissue is known as the granulation tissue. The granulation tissue is extremely fragile in the early stages. Over the next few days, the number of collagen fibers increase and the collagen fiber begins to align themselves in some pattern that resembles somewhat to the pattern of the original tissue. The end result of the phase of repair is the formation of scar tissue. The formation of scar tissue indicates that the gap created by the injury is now bridged by new tissue. However, the mechanical strength of the scar is less than that of the normal tissue. The last stage of healing is known as maturation or remodeling. It continues for a pretty long time. The aim of this process is to increase the tensile strength of the repaired site and to have a connective tissue that resembles closely to the injured tissue in structure, function, and the mechanical strength or the load-bearing capacity. The tensile properties of tissue during healing process respond to the changes in the physiological stress and motion. The mechanical strength of collagen fibers depends on the orientation of fibers in the tissue. The collagen fibers orient themselves parallel to the line of imposed stress. So carefully progressed mobilization, it enhances the mechanical strength of the repair, whereas the prolonged immobilization reduces the mechanical strength of the repaired tissue. After discussing the pathophysiology of injury, now we will talk about the management of sports injury. Repair of an injury is a natural process. The different method of treatment, they work to reduce the impact of those factors that tends to retard the rate of healing. The ultimate result of healing is a scar, a fibrous tissue strong enough to withstand the higher load of athletic activities. Most of the soft tissue injuries are treated conservatively. Occasionally, when the loss of tissue is substantial, then the surgical procedures are also required to restore the anatomical continuity. The second aspect of the athletic care is the minimization of impairment and maintenance of fitness. The maintenance of physique and performance require regular participation in training. A sports injury disrupts the normal training schedule of a player, and it gives rise to decline in the parameter of flexibility, strength, balance, and cardiopulmonary endurance. And all these culminates into deterioration of performance and sports skill. It is important to blunt the impact of retraining by instituting alternating exercise schedule that does not disrupt the healing process. The third aspect of the management of sports injury revolves around identification and correction of the risk factors of the injury. If the risk factor of injuries are not removed, then despite the healing and repair, the player will be at risk for the reoccurrence of the injury. The period of healing and repair, it provides an opportunity to detect the hidden areas of biomechanical abnormalities and the impairments of strength, range, and balance. The treatment and rehabilitation period provides an opportunity to identify and correct the intrinsic and extrinsic risk factors of injury, such as biomechanical malalignment, deficiency in fitness parameter, inadequacy of sports skills, and the psychological traits of the athletes. The management of a sports injury, it can be broadly divided into three phases: the acute management or the phase of damage control, the promotion of healing or the treatment stage, and the remodeling stage or rehabilitation stage. The focus of the management of acute stage is the control of inflammation. The control of inflammation, it revolves around 4 points. The number one, reduce the initial damage, reduce the blood flow to the injured area, reduce edema, exudation, and prevent the release of chemical mediators. The protection, rest, ice, compression, and elevation are the methods used in this stage. Protection employs placing the injured tissue in safe and comfortable position, and it involves the application of tape, bandage, strapping, splint, and occasionally plaster cast to the injured part. Rest or cessation of activity following injury is required to reduce bleeding and swelling. Movement at the site of injury may disrupt the fragile fibrin bonds. The patient should be advised not to participate in any activity which might place undue stress on the injured tissue. The movement which replicate the mechanism of injury or increase the pain should be avoided. However, the total bed rest is seldom required, and adjacent non-injured parts can be exercised within the limit of pain. Ice application produces vasoconstriction and reduction of blood flow, which helps in reduction of inflammation, swelling, muscular spasm, and pain. Ice should be applied immediately following acute injury for 20 to 30 minutes and should be repeated after every 2 hours. Compression of the injured area with elastic bandage contributes to stop bleeding, inhibit seepage of the fluid into the underlying tissue space, and promote absorption of the edema fluid that helps limit future adhesion. During the first 72 hours, as much as possible, the injured part should be elevated above the level of heart. The elevation facilitates drainage of the accumulated fluid, and along with ice and compression, it helps reduces the swelling. The initial management of sports injury can be rendered by anybody, and in fact, all individuals dealing with sports should be familiar with the first aid of the injuries. In addition to price regime A variety of non-steroidal anti-inflammatory drugs and electrotherapeutic modalities are also used by clinicians to reduce inflammation and offer comfort. But anything that increases the blood flow to the part and put the injured tissue to further stress should be avoided at all cost. Heat, alcohol, running, massage have no place in the management of acute injuries as they produce dilatation of blood vessel and they increase the extent of the injury. Along with price, the another R is now added. This indicates for referral. Whenever the acute injury is associated with immediate gross swelling, deformity, severe loss of function and loss of pulse, then the player should be referred immediately to a nearby hospitals because these signs they indicate a serious injury which cannot be managed on the field and the immediate medical attention should be given to the player. The facilitation of repair phase is the time period when the actual biological repair of the injured tissue takes place. In about 80% of injuries, the natural biological repair takes place and the conservative management in the form of physiotherapy modalities and exercises can bring about complete resolution of the symptom. In only about 20% injuries, the skilled surgical intervention is required for restoring the integrity of the damaged tissue. The treatment objective of this phase are to protect the healing tissue, increase the blood flow, enhance removal of debris, prevent consolidation of swelling, and to stimulate the rate of collagen synthesis. Heat and increased blood flow is now desired as it brings more blood cells to the area and accelerate the cellular activity. The protection of the injured part should continue, though complete immobilization should be avoided. The complete immobilization of the part gives rise to joint stiffness, muscle atrophy, weakness, poor nutrition to the joint cartilage, which leads to the degeneration of the cartilage and the joint structure. In this stage, heat and increased blood flow is desired as it brings more blood cells to the area and accelerate the cellular activities. Protection of the injured part should continue, though complete immobilization should be avoided. Complete immobilization of the part gives rise to joint stiffness, muscle atrophy, muscle weakness, poor nutrition to the joint cartilage leading to degeneration. Therefore, only movements in a direction that would cause excessive stress on the injured structure should be restricted by advice or by the use of tape or brace. The movements of non-injured areas and those movements of injured part that does not stress the injured site should be encouraged and exploited for maintaining the different aspects of fitness. This approach is called protected mobilization, which minimizes the negative effects of complete immobilization. The movement of non-injured areas and those movement of injured parts that does not stress the injured site should be encouraged and exploited for maintaining the different aspects of fitness. The treatment method employed in this stage can be grouped under the four broad headings: manual therapy, electrotherapy, exercise therapy, and patient education. Manual therapy methods like joint mobilization, soft tissue mobilization seek to restore the mobility of the injured area by preventing and mobilizing the adhesion. Whereas the various electrotherapy modalities like ultrasound, shortwave diathermy, microwave diathermy, various electrical stimulation currents are used for facilitating the biological repair and smoothing the process of range and strength restoration. Exercise therapy addresses the goal of minimizing muscle wasting, restoring the movement pattern, and developing the strength and coordination. It is important to understand that in the absence of active exercises, the benefit obtained by manual therapy and electrotherapy modalities will not be retained for a long time. An informed player demonstrates better compliance to the treatment. Therefore, re-educating the player on the importance of prevention of injury, causes of sports injury, need for restructuring of the training schedule should constitute an active part of the management process in the repair stage. At the end of the second phase, the signs and symptoms of the injuries are eliminated and athlete finds no difficulty in performing daily activity. However, the mechanical strength of the tissue remains poor, and if it is exposed to the full stress of the competitive sports, as such, it might be damaged again. The sign and symptoms of injury are eliminated at the end of second phase, and athletes often find no difficulty in performing activity of daily living. However, the mechanical strength of tissue remains poor, and if it is exposed to full stress of competition, then it may be damaged again. Therefore, it is important to increase the mechanical strength of the repaired tissue by gradually exposing it to the higher training load. Reconditioning of the recovered lesion is the last stage of injury management. The objectives are to maximize the loading tolerance of the repaired tissue and condition the body in general prior to returning to the competitive sports situation. This phase is mainly exercise oriented, where the injured tissue is subjected to gradual loading in an attempt to produce near normal like alignment of collagen fibers of the scar tissue. In addition, the specific attention is now paid to correct deficit in range, strength, proprioception, agility, aerobic and anaerobic fitness, and restoration of sports specific skill. Successful completion of the repair of injury require a closer cooperation between the physiotherapists and the coaching staff, because the treatment of sports injury often require a significant restructuring of the training schedule of the player, and without the coordination and cooperation between the coaching staff and physiotherapist, the complete implementation of this phase is not possible. When the sports injuries are managed successfully, it produces minimal scarring, minimal adhesion, no pain, no restriction of range of motion, normal strength, and back to the function. Whereas, if the sports injuries are not managed properly, it gives rise to excessive scarring, adhesion formation, loss of range of motion, all of which act as a source of continuing pain. It may also give rise to loss of stress and may lead to re-injury of the part. One of the main reasons for recurrent injuries is the early return of player to sports without completing all the three phases of management. Return to full sporting activity depends on the realization of some criteria. There should be pain-free full range of movement of the joint, no swelling, the muscular strength and endurance should be adequate, the player should have good flexibility and a good static and dynamic balance, the cardiopulmonary endurance should be adequate enough to meet the demand of the game, and the skills of the sports must be restored to the effective level. More importantly is the lapse of the time constraint for healing. Besides injury, the another area that concerns the player is the recovery. Many times we hear that player consumes lot of substances in order to facilitate the recovery. Many a time the rigor of training is such that player finds difficulty in withstanding it. Recovery from the exertion of exercise is one of the prime concerns of every professional group dealing with physical exercise. After exhaustive physical task, the ability to repeat the same performance reduces, and a number of unpleasant experiences like soreness, breathlessness, reduced drive, etc. are felt. Excessive volume of intense training and competition, particularly with minimal recovery time, can place great physiological constraint on the musculoskeletal system. These may culminate into overtraining syndrome at the systemic level and overuse injuries at the local level. Therefore, the recovery from the stress of the exercise is of paramount importance. The objectives of recovery are restoration of function, restoration of the capacity of neuromuscular system, tissue repair, resolution of muscle soreness, psychological recovery, and replenishment of nutritional energy reserves. A number of methods are employed to expedite the recoveries. These methods they range from psychological techniques, nutritional supplementation, and application of physical agents and specific exercise. The physical procedures for speeding recovery from exercise can be grouped under two broad categories: active recovery and passive recovery. The practice of performing low intensity aerobic exercise after a high intensity exhaustive exercise is known as active recovery. In passive recovery, the engagement in physical activity is discouraged. The modification of passive recovery includes massage, cold shower, specific body positioning, sauna bath, hydrotherapy, etc. Both categories of recoveries has their own advantage and disadvantages. The three claimed main advantages of active recovery are maintained muscle pumping and prevention of venous pooling, faster removal of lactate accumulated during intense exercise, and the improvement of subsequent performance. However, concerns have also been expressed on the efficacy of active recovery in facilitating the recovery as a whole. Many researchers of late have started considering active recovery disadvantageous as it further stresses the cardiovascular system and affects the resynthesis of energy reserve, apart from increasing core body temperature in tropical climate. The passive recovery, on the other hand, has been shown to result in greater amount of muscle glycogen synthesis. The methods of promoting psychological recovery and nutritional recovery can also be administered effectively during the passive recovery. Irrespective of the type of recovery methods, every player must be provided with the opportunity to recovery either actively or by the use of passive procedures. The facility for treatment and rehabilitation of sports injury and recovery of athlete must be integrated in every training center. In summarizing the lectures, we can say that sports injury is a disruption of the musculoskeletal structure. The treatment of a sports injury, whether conservative or surgical, seeks to bridge the gap created by the injury. The healing of injury is a natural process that can pass through the three overlapping stages of inflammation, repair, and remodeling. Price is the standard treatment in the acute stage of injury. The activities of repair phase can be accelerated by the use of heat, physical modalities, and the exercises. The third phase of injury repair is mainly exercise oriented, that seeks to correct the existing impairment and restore the form of the athlete prior to return to the normal play. The return to full competition requires restoration of range, strength, balance, agility, cardiopulmonary endurance, and the sports skill. The early return of player to play without completing all the three phases of management has the chance to produce re-injury, and it also reduces the performance of the player. The athlete, after a strenuous training, must be provided with the opportunity for physical recovery. In order to ensure adherence to the regular training and excellence in the performance, it is necessary that a system of early identification of injuries and its management and a system of recovery must be integrated with every sporting facilities. Thank you.